the medics will be able to corroborate to that and also give us information, because right now it's a guessing game. We have these visuals that we had put on air, and what was concerning was that there were so many children, and these hospitals in those regions in northern province were overcrowded, and there obviously seemed to be a paucity of doctors who were attending to these patients. Do you think that at this point of time is the Chinese administration and the medical system equipped to handle these large number of cases as are being reported?
Okay, I shall be speaking largely about the medical and clinical aspects. As you know very well, as China is a mystery land, everything has to be guessed. So how serious is that? And let me tell you, even after the corona pandemic and the second or third wave was over, we heard of many more waves. They were not corroborated or verified, so we never took them seriously. That time also we were asked, can the same wave come in India or not? So first thing, this is a human beta pneumovirus, is a respiratory virus, and don't forget, whatever we speak, since it's a public channel and people listen to it, in India panickiness spreads fast. So let me tell you, even the same time as our panelist from Hong Kong was saying, that it happens in India otherwise also. In India also, in OPDs, we are seeing increased number of cases of flu, influenza. So as you know, the laboratory system in Delhi and NCR or in other parts of India is not that elaborate. So we never come to know of it. So first thing which people since don't mind, since morning at least dozen patients have asked me, doctor, is it going to come in India? So let me tell you, there is nothing of that sort coming in India, number one. It is not a new virus, it is an old virus. Yes, the so-called influenza and all these viruses, they tend to mutate very fast. They tend to come again and again, and particularly the children below 5 and the elderly people. Let me tell you, in India, we have a huge load of elderly people and people who have other comorbid conditions like some like uncontrolled diabetes, some organ transplant patient, some HIV patient, some chronic diseases patients, all those people, elderly people who are 60, 70 plus, who
Okay.
are living the life on, listen, let me complete, who are the living the life on an edge. Let me tell you, they are the people who need to be protected. The whole conclusion of this story is these people must be protected. We have the influenza flu vaccine in India, which should be taken in October every year. We have the pneumococcus vaccine, which should be taken every year to all these serious category of patients and all the senior patients. And
Okay,
plus
all
our
right, sir.
children,
I'll come back to you. I'll come back to you. Joyita, quickly coming to you and getting your perception of the situation which